The fight against the coronavirus is in its second year, and in the last year and a half, there is something new that the world learns about this virus almost on a weekly basis, whether it's a new variant, new symptom, or its after effects. Well, one such after effect is putting patients and doctors to a state of panic across India. It's the black fungal infection, scientifically called mucormycosis. The rare fungal disease is hitting COVID-19 patients as the healthcare system continues to reel under massive pressure. As of May 19th, the last at least 7,250 cases of black fungus have been reported in India.
हमारी इस लड़ाई में अभी इन दिनों ब्लैक फंगस की एक और नई चुनौती भी सामने आई है। इससे निपटने के लिए जरूरी सावधानी और व्यवस्था पर ध्यान देना जरूरी है।
Hospitals are now facing a shortage of medicine used to treat this fungal infection. India's health ministry says that it was looking to rope in more companies to produce the anti-fungal drug. 5 additional manufacturers have been given license to manufacture the drug, and the production by existing 5 manufacturers have also been ramped up. India also plans to increase its import of the antifungal drug to fight black fungus. Meanwhile, on Thursday, the government asked all states to declare black fungus as an epidemic. The health ministry has asked states to list it under the Epidemic Disease Act 1897. This means all confirmed or suspected cases have to be reported to the health ministry. All government and private health facilities, medical colleges have been asked to follow guidelines issued for screening, diagnosis, and management of cases. Delhi has set up dedicated treatment centers for black fungus in 3 hospitals. While the news of this symptom has sparked widespread alarm, it's important to understand that it doesn't affect everyone. So, let's understand what causes this infection and why it is suddenly being reported in COVID-19 survivors. This rare fungal infection is caused by a group of molds. The black fungus affects the sinuses, the brain, and the lungs. While it's been observed in recovered COVID-19 patients, it mostly affects immunocompromised patients like those with diabetes, cancer, and other diseases. According to the US CDC, it's most common in diabetic patients. So what are the symptoms? Well, it ranges from a headache to even nasal congestion. Patients typically have a stuffy and bleedy nose, swelling and pain in the eye, drooping of eyelids, and often loss of vision. If diagnosed late, it even has a mortality rate of around 50%. Prior to the pandemic, the infection was very rare, but the sudden rise can be attributed to multiple factors. One is the use of steroids in COVID-19 patients. The black fungal infection may be triggered by the use of steroids. Exposure to wet surfaces also increases the chances of infection. While the frequency of this fungal infection is on the rise during the second wave, one way to stall it is administering the right dose and duration of steroids. When detected on time, it's often treated with an antifungal intravenous injection. In the Indian state of Bihar, 4 cases of white fungus infection have also been reported. This infection is considered even more dangerous than the black fungus. Experts say the white fungus infects lungs as well as other parts of the body, including the skin, stomach, kidney, brain, mouth, and private parts. Okay, for more on this, we are joined by Dr. Rajesh Malhotra, the Chief of COVID Center at New Delhi's AIIMS. Thank you so much for joining us on WION. Doctor, as we're seeing the overall numbers continue to dip across India, a new challenge of black fungus cases is now surging. Can you explain the reason for this sudden jump in fungal infections in COVID-19 patients?
that the black fungus selectively attacks the diabetics, the people whose immunity is suppressed, people with kidney disease, people with cancers, especially blood cancers. And this wave actually, one is that the numbers have been too high. So if you look at the number of cases which we had, so even 0.02% incidence will translate into a large number. So that's problem number one. Number two is that we have had steroid use like never before in this, because we have seen that steroid and oxygen are the only two really life-saving treatments in COVID. So this particular time, I think a large population received the steroids, and very often at an inappropriate time, in an inappropriate dose, and for an inappropriate duration, with the result that the sugars really skyrocketed. Those who were not diabetic also experienced high levels of blood glucose. Now we know that the black fungus attacks people once, even after they have recovered from COVID and have gone home, and maybe anything from 2 weeks to 6 weeks. And that is the time when, if you have continuously high blood sugars, or you are still suppressed, or many patients are being discharged on small doses of steroids, and that those are the cases which become very, very prone to get black fungus, particularly if they don't take precautions like avoiding dust, avoiding the soil, avoiding the other sources. We know that the fungus is everywhere, but it is particularly found on decaying wood, decaying food, decaying vegetables in the soil. So you have to be very, very careful. And that's another place where, wearing masks, gloves, and shoe cover and all, if you're going outdoors, or particularly in your garden, would be very effective.
And what kind of treatment is being provided to these patients suffering from mucosis? We are now hearing reports of a shortage of amphotericin B. And on the one hand, the government is making an all-around effort to ramp up supply and availability of the antifungal drug, which is essentially used for this infection.
All, whether it's black fungus or white fungus or whichever fungus you want to call it, a fungus does not actually or cannot cause infection in a healthy person. So once your immunity is down, then you get all kinds of fungal infections. So the commonest fungus involvement even in COVID is not black fungus. Actually, it's something called aspergillosis, and that's a fungus which is actually seen in ICU in maybe 1/3 cases. It's been reported from all over the world. And we also have something also called as white fungus, is called Candida, which is very commonly seen in diabetics, when they have this ulcers in the mouth, which looks whitish. It's called oral thrush. And similarly, you can have the same thing in the private parts, where a whitish discharge starts coming out. All that is white fungus. The fungus, even the black fungus, can involve the lungs. So similarly, the white fungus can involve the lungs. The tricky part is that, it's very difficult to diagnose this kind of infection of the lungs by fungal infection. It may not happen in diabetics, the white fungus, but it does happen in people who have been in ICU for a very long time. They may be immunosuppressed. Of course, if you are diabetic, you are at a higher risk there also, but they are non-diabetics and all can also get these kinds of fungal infections, particularly, like I said, aspergillosis. And there, the X-ray is not much different from COVID, but the COVID test is consistently negative. And another confounding factor is that these kind of fungus may be present in the oral cavity or throat of a normal person also. So unless you do some bronchoscopy and get some fluid from deep inside the respiratory tract, and then grow fungus in that, you cannot be sure that it is that fungus. And because I told you these fungus can be normally present in your body, when they are attacking and causing infection, they are called invasive. So they can be invasive candidiasis or invasive aspergillosis. which are actually again need antifungals like we discussed in intravenous form, and they are very difficult to treat. And even if somebody is having that fungal white fungus infection of the lungs, that itself can kill. Not necessarily the COVID, even that fungus can kill because it's very difficult to eradicate. The drugs are very toxic. And when you use them in large doses for a long time, just like the fungal infection can occur if you use antibiotics for too long, you can get other bacterial infections if you use antifungals for too long. So it becomes a very complex situation where an immunosuppressed person whose immunity is compromised is actually jumping from one complication to other.